We have Nancy Sasaki, the CEO or Executive Director of the Alliance Healthcare Foundation. Dr. Donald Kearns, the President and CEO of Rady Children's Hospital, and Baron Herdelin-Doherty, President and Chief Executive Officer of the Greater San Diego YMCA, or Greater YMCA of San Diego County. Let's give them all a round of applause. Thank you guys, all of you, for being here. This is in some ways, this panel is the perfect manifestation of what we try to do at State of Reform in terms of getting different silos together, different blind men and women, so to speak, around the elephant that are all expert in their area, expert on their part of their elephant, but maybe don't always interact with other parts of the elephant. And so to maybe overuse that allegory a little bit, Nancy, let me ask you, when you are thinking about your organization that invests in a series of things that support health and well-being and wellness, as you think about this broader conversation around health policy and health reform and health care and costs and politics and all of this, in some ways, distasteful stuff, where do you find the biggest opportunities to have real impact in the work that you do amidst this dynamic, cluttered, noisy field and time?
Good question. Y'all probably all know that they don't prep us on any of these questions ahead of time. So this is like completely like, huh? Anyway, what's really interesting, I think, in all of this conversation, and even as DJ was saying the question, the piece that's always missing is the people that we're trying to serve. And so I think that the opportunity is really looking out there and finding those organizations that are doing amazing work in our community, that are really heads down, looking at how they can serve people in our community to improve their health, to improve their access, to help them navigate through the system, whatever role that they're playing. So I think that there's still a really big opportunity there to include the voice of the people and to reach out to them and have more of that incorporated into the policies and changes that we're trying to make in our community.
You're right, of course, Nancy. We don't give you guys much to go on other than we appreciate and are happy to have you here. And you were very gracious in saying yes, Nancy. You're then very gracious in saying no, thank you. And then we talked you into sticking with us, so thank you.
The reluctant panelist, I guess.
Yeah. Baron, let me ask you kind of a similar question. Where do you see the opportunities for the Y to make investments that matter in impacting people's health in maybe a different, a little innovative way, given the unique perch that you have?
Well, we want to engage anywhere there's not, YMCA or not YMCA members, or where there's people and they can't get to a YMCA. So we want to have, and that's a part of our strategic plan, our current plan, to build YMCAs where there are people who want to come to a Y, but there's not a Y close. How do we get there? Well, we can raise money and buy land and build things, but we could also partner with hospitals or churches or school districts or recreation centers or cities or counties or anybody, anything, just to try to serve more people, getting them healthier, getting them active. The YMCA is about families. We don't define that. We just serve families. So if you think you're in a family, bring that group of people. That's a family. Come on, we'll serve you. So how can we find all the different ways, either we've thought of or we haven't thought of? We just know that we have to partner to get there. Even if it's with other nonprofits, either same providers, if you will, Boys and Girls Club for us, Big Brothers Big Sisters, Armed Service YMCA. Who else can we partner with to get that service to the people? Because it's not, I compare it to like Home Depot versus the old local hardware store. We want to be a little bit more something in between. We don't want to be the big box, but we don't want to be little bitty, so we want to have more locations to serve more people in an equal way.
Yeah. The YMCAs have taken on a little bit of a unique, some of them at least are thinking a little differently, and maybe I would sketch that out in further detail by saying, if people and families are coming for family support services, for athletic and wellness classes, yoga, which has a mental health component.
Sure.
In many cases, you have mental health therapists and delivery providers. In some places, you're doing a lot of work around diabetes. That starts to sound something like a health home, or maybe a primary care-like setting. Do you think of, when you're talking about building buildings and doing fundraising, do you think about your strategic future as kind of a health or well-being home?
Well, I know we will be, because it's not in San Diego yet, but when one of the local hospitals will let us, we could build together, because there's over 100 co-operated YMCAs and either hospital-led or insurance-led rehabilitation centers, wellness centers, where people move from the hospital environment or the rehabilitation environment to YMCA participation. So I can take you on a field trip to many different places. Tacoma, Washington, you're from Seattle, so show you where there's 3 branches in that community built with a partnership just like that.
With a lot of kids that come through your doors, yeah.
Families, kids, active older adults, all those people. So it really has no limits. It's all the people we serve. It's just engaging from medical opportunity when they're changing their lives, and then giving them a place they can keep the continuum going.
So are there any local hospitals that deal primarily with kids that you think could be helpful? Maybe I should ask. Maybe I should ask Dawn.
Maybe we can sign the deal today.
I should ask Dr. Kearns. How do you see Rady, that's doing deeply innovative stuff, deeper in the area of specialization, meaning things like genome-specific care for children, for neonates, et cetera. But how do you see Rady fitting into the broader, more general context of healthcare in the community? Children's hospitals are well regarded for doing amazing life-saving stuff in this area of specialization. How does that fit into the broader community?
Yeah, it's a nuanced approach to it. So I, on Friday, celebrated my 30th year at Rady. I've been there my entire professional career. And I've seen the hospital evolve into a world-class academic medical center. And we have recognized that we have this covenant with the community. We take care of 92% of children in our community. And so when you're thinking about kids and families who have a child with a problem, you're going to be attached to Rady Children's at some point. And I think when I listen to Nancy and Barron talk about what they're doing, a lot of what we all recognize is we can't all do this alone. So this whole idea of collaboration is incredibly important. And Barron, threw a dart over here, but he and I have actually been talking about this. So there is huge opportunity for us to work together. But to specifically answer your question, our strategic plan now in the next 5 years is twofold. One is to be consistently excellent. So specifically taking care of children who have significant problems that are fairly commonplace. The kid who's got a broken bone or an ear infection or is having problems with depression. And yet we also want to be selectively distinctive. And when you talked about genomics, that was a gift from Mr. Rady, who gave us $120 million to get the first pediatric genomics center off the ground. And I'll tell you that we're doing things here that nobody else is doing anywhere in the globe right now. We're saving babies' lives using precision medicine. Again, not happening anywhere else because of that gift. But we can't forget about that consistently excellent business, because San Diego's the largest city in the United States with one children's hospital. So we need to be everything to everybody. And the fact that we have a community that can figure out how to collaborate is incredibly important.
Yeah, Nancy, I know you wanted to jump in.
Yeah, it's really reminding me of an article I read recently where we're moving away from the medical health homes and we're starting to talk a lot more about community-centered health, community-centered care, so that you talk about the hospital and you talk about the nonprofit providers that are working with the same communities, and how do we help the hospitals do this excellent care, and how do we keep people healthy in their lives and in their where they live, so that it's more of a community effort as opposed to the Y's working over here, the hospital's working over here, and there's another organization over here working on the food issues that family has. But what happens outside of all the walls? Why don't we again get back to the people and look and see how do we all work together in this community to really understand all of the aspects. In the session I was sitting in earlier with 211 and looking at the Community Information Exchange, which was one of the projects we helped to fund and get off the ground, it's trying to do exactly that and look at all of the aspects of a person's lives, whether it's food, utilities, rent, housing, whatever it might be, to be able to say, this person's critical, this person's thriving, and how that ties into the records that the hospitals, that the nonprofits have in order to better serve that particular person and that particular family.
Yeah. Do you see philanthropy, Nancy, as, rather, let me preface by saying there are at least two philosophies about the role of philanthropy, and one of them is that you want to think like a venture capitalist and look to find opportunities where with additional resources you can scale significant system level change. Another is to look at the gaps in a community and try to fill in where, for whatever reason, other institutions are not. Do you see San Diego philanthropy, do you see the philanthropy at your foundation as playing a little more of one of those two or another, or a different philosophy when it comes to funding?
I think that maybe, I don't want to think that we're unique in that way, but I do think in some ways we are, because we do have one fund that is looking at how we're innovative. How do we do things that might be systems change related? How do we do things that are bigger than the innovation fund, so that we have a bigger legacy impact on the community? But we also recognize that we can't do that without our nonprofit providers. So how do we fill in the gaps for them? And our mission support grants, they can use them however they need to use them without being related to a particular project. So we're trying to do both, but recognizing that even at the size of our foundation, which sounds like a whole lot of money, if you distributed that to everybody, everybody would get like $1, and that would not go anywhere. It wouldn't change people's lives. So how do we partner with the community, partner with our nonprofit as well as our hospital providers and other people in the community in order to do both, be strategic, to be bigger thinkers, to be innovative, to be the venture capitalist, to support an idea. The Community Information Exchange came to us as, we think this could work, kind of an idea, and we've just partnered with them to help make it happen. At the same time, trying to understand, like, how do we bolster the nonprofit provider community as well, so that they are as strong as they can be.
You know, Baron, I'm getting to know San Diego. I'm not fluent in San Diego. Yeah, a few more. But I hear when I listen to folks speak at our event or in the hallway, and as you know, we've talked with our community panel, that there is, as Nick Mascione talked about at lunch, this sort of co-opetition model of sort of collaborative competition in the San Diego wellness and health community. But it's also a little tricky to get people to come play ball in a meaningful way sometimes. What do you make of that as somebody who's been in the game a long time, been in California 7 years, but you know, is it harder to do things in a meaningful way in San Diego than maybe other places? How do you put that in context?
Well, I was going to comment on what Nancy said. I think that we have to give them one example, them being us, really. If we could find two nonprofits, and I really like the hospital nonprofit YMCA, Boys and Girls Club, do something like that. The donors, the funders would say, you know, if we could bring some donors, let's say we had a $30 million project, and we brought $15 million, and a hospital, Rady's Children's Hospital, brought $15 million, and then Nancy could find $1 million because she would normally give $500,000, she would give $1 million because she liked the example of that partnership. And all we have to do is once again go to the examples in other states. I do find that the other states that I've lived in, 6 other states with my Y career, it has been easier. There are partnerships in hospitals and YMCAs and rec centers and Boys and Girls Club building these co-inhabited spaces where we're, you know, working on health, you know, and somehow we take the walls down. I mean, we have donors Don has donors. They are very prideful. They don't. It's not, I don't think Don and I can figure this out. I think that's not the problem.
Yeah.
It's the donor base that really is so focused on medical, and they don't see medical tied with health in a lot of situations.
And I think part of this is selling the idea of creating health in the community.
Yeah.
And as much as it makes sense to us, it's a little hard to convince people that that's the future. And I think all of us in this room recognizes that society is done with paying 19% of the GDP for healthcare. Yeah. We're going to have to change that. We're not going to continue down this road. And Rady has taken a lead nationally around creating at-risk models so that we take greater control of healthcare. But until we can prove that that's incredibly successful across the board, it's hard to get philanthropists interested in it. And the 21st century philanthropist is not necessarily, at least the ones I'm dealing with, are not necessarily interested in funding a project. They're interested in achieving a dream. Mm-hmm. And when I have conversations with them, it's not about, hey, can you help us keep the lights on? It's about, why don't you go out there and cure cancer? And that's a different return on investment. And when we talk to them, it's a different story. And it takes a lot of work to get to the point where they trust you enough and have enough confidence in you that they actually think you're going to help them achieve their dreams. Mm-hmm. And you've got to be able to show success there. I've an interesting aside here around philanthropy. Barron and I are both cyclists. He's a much better cyclist than I am, but I'm much better at raising money on a bicycle than he is.
That's why I stay with him.
I was recently on a bike ride and got to talking to the guy next to me, and he asked me what I did, and I said I worked at Rady, and he said, oh, I'm the CEO of the Copley Foundation. Would you guys like some money? So they
You
just
must be
gave
a
us,
very good cyclist.
yeah, they just gave us $5 million to create the first ever pediatric psychiatric emergency department in the world.
Wow.
So maybe the lesson learned is you should all start riding bicycles because you never know who will be riding next to you.
They say the cycling is the new golf.
Apparently, yeah.
But I was going to say it's really interesting because I think that there has been a shift in philanthropy in terms of maybe it's the big dream, but sometimes it really is like, what is the real outcome? I think philanthropy is moving away from just the numbers walking in the door and wanting to understand what happens to those people when they walk out of your door. What has your service done to better their lives? And since we're so much focused around health and wellness, it's about their health and their wellness. And how do you track that? How do you know you're making a difference in their lives? I also think that what's happening that's helping providers be better collaborators is that the funds are getting less and less. And it's costing more and more to do what they're doing. And so they're having to work together to make those funds go a little bit farther. But I also think that it's a challenge because until you can see that you really have a role, it's hard to put that risk and put yourself out on the table or your services out on the table if nobody else is. And so I think it's a really hard thing to do to collaborate effectively, not out of, there's a lot of people out there in our community who want to collaborate. It's just how do you do it effectively without getting run over by somebody that's maybe bigger or that your idea gets stolen or, there's so many things that could happen that cause people to be a little bit more closer to the vest as well as not wanting to challenge those dollars because there are very few funders who will say, well, I would have given you 250 and I would have given you 250, but since you're working together, I'll give you $1 million. They're just not willing to kind of take that risk a lot of times.
And they're managed and garnered by foundation rules. I know the foundation or the person he's referring to, and we have a YMCA named after that family. So we really are working together, but would it have been cool? It would have been more cool, I think, regardless of how much we would have gotten, to put that aside and say, hey, let's just go see what we can get with this concept. And it's just so much more powerful because I think at the end of the day, if we could get people to get fired up about preventing things, preventing these issues with their health, and of course older people, it's going to be harder because they're older. But to get the young people, and that comes through family and culture and change. I mean, we know the statistics. It's going to take decades to get there. I mean, we will have less hospital needs if we had hospitals running wellness.
Let me ask you this, Donald, because you are the true healthcare person on this stage, you know, deeply embedded in it. Not that you all aren't, but running a children's hospital is pretty healthcare centric.
Yes.
This kind of enthusiasm around collaboration that we're talking about here seems like it is in some ways a culture apart from a lot of the discussion in healthcare specific circles. It might be hospital, health plan, provider groups, but that collaboration doesn't seem to, that's not a cup that overrunneth, so to speak. I don't often see the same kind of enthusiasm. Do you, in your experience, see this level of enthusiasm about collaboration with other hospital partners or other health plan partners?
So I'm going to suggest to you that, and I'm a little biased, children's hospitals are a little different. And I will tell you, and again, you're not from here, but all the adult systems in town have neonatal intensive care units that are ours. So there are license, our patients, our electronic medical record, our culture. So we've created joint ventures in their brick and mortar rather than going out and doing this on our own. And it makes sense for all of us.
Yeah.
So we, as a hospital system, have figured out a way how to collaborate with a lot of adult systems. The adult systems sometimes don't do such a great job collaborating with each other, but we figured that out. That's not unique. There are other children's hospitals across the country that have used that model. But as a children's hospital, we don't have a lot of money. I mean, we are not rolling in the dough. You don't take care of kids expecting to make a big margin. So we cannot be everything to everybody without collaboration. So it's the nature of the beast. For us to be successful, we've got to figure out how to work with other people.
And that margin comes in significant part because so many kids are covered by Medi-Cal, right?
Yeah, absolutely.
So do you think that reduction, would you tie that lower margin to an increased willingness to be collaborative and open? I assume that's almost a linear connection, right?
Well, I would probably argue it's because we're such great guys and gals.
Yeah.
But you're probably right.
Yeah.
Because I can't afford to do all those things on my own. So it forces the collaboration. But it's been the right thing for our institution, and it's allowed us to centralize all the most specialized care. So it's been very successful for us, but if you made me guess what forced it to happen, that's probably a lot to do with it.
I mean, Don Berwick argues that cheaper care is better care. You know, that the more you take money out of the system and make everybody sort of work harder,
Let's call it more efficient.
It becomes a little better care. Nancy, in your role at Planned Parenthood prior to the Alliance Healthcare Foundation, Planned Parenthood is a very large provider of healthcare services. Do you see that playing out, that sort of lower margin care actually forces collaboration, you know, either in your perch now at the foundation or prior at Planned Parenthood? In other words, does a little less money just engender more creativity and more cooperation?
Yeah, it's interesting because I'm actually having some conversations with some former colleagues at Planned Parenthood, and that as the price of pills started going up because of some changes in managed Medi-Cal and the reimbursement rates and how much you could actually buy them for, 340B pricing, all of that kind of thing, Planned Parenthood actually created a separate entity to manufacture their own birth control pills in order to maintain the pricing.
Wow.
And through the creation of that manufacturing source, they also sell those pills to other community clinics that are needing to purchase pills. And when I touched base with them, you know, initially we were thinking maybe 1 or 2 pills we could maybe manufacture. They have 6 or 7 pills now that they are actually manufacturing for themselves as well as other community clinics in order to maintain a low price. Now they're looking at doing some other things also, and they've also moved into using apps. They've moved into using some telehealth in a different way. And it has been because of those margins that caused them to try to figure out how do we continue to maintain the service levels that we have always had in the past. In addition, when I first started working with Planned Parenthood, maybe in the early 80s, there were over 200 affiliates throughout the country. Because of mergers and the need to be at a certain size to have a certain amount of capital that in your reserves and everything, there are 56 affiliates in the country now. Same number of clinics, but the kind of the administration levels have all combined in order to be more effective.
You know, Baron, this is a little bit of a softball that I'm going to try and make harder, but I mean, the question I want to ask, not gratuitously, because Nick Mascione has been helpful and is in the room, but I think that San Diego does have a reputation of having a unique county, geographically, demographically, and unique county leadership in terms of healthcare and human services. So what is that experience like as a county, being in San Diego County with a county government that has kind of this unique purchaser and convener role? I mean, as I said, Nick is here, so I'm sure it'll all be rainbows and unicorns, but you know, how does that sort of influence and impact the way the Y does business and some of your partners?
It gives us resources, and we have so many individuals like Nick to support us, other county representatives. We get called to help in situations. We find on both sides we're giving and we receive many, many times. And of course there's responsibility with that, there's standards, there's protocol we have to follow, but it just opens up opportunities for us to serve people. Very open there where other nonprofits, when you get into the other agencies and including hospitals and whatever, it's just a little more new to us, new to San Diego for sure, where it's not new to the United States, as I mentioned earlier. So it's really refreshing to have that kind of support where they know that we can follow through. And our YMCA here in San Diego is super blessed because we have a very rich history and heritage of service and quality overall, and there's things we could do better obviously, but we have a very big level of performance for our size, the second largest operating Y in the United States, even though we're not the second largest city, but that comes on the heels of people and service that's happened before us. Partnerships with school districts, 8 of them, the branches that we have and the ones we're building, it just gives us a certain bunch of resources that allows us to do more than the average YMCA. Seattle, where you're from, another YMCA that's a larger Y. The bigger the Y, the more resources, the more nimble you are, or we are, to do these kind of partnerships with the county and the cities that we represent. And we're not always a cash cow, but we can definitely bring resources to the project.
Is there something more that the county could do in that unique role that might spur even more and faster and more collaborative, deeper collaborative efforts in terms of driving wellness in San Diego County?
I would say this would be the answer for the county and the cities that we work with, along with any of the donors or foundations specifically, because if they ask us specifically, if you were YMCA, do this partnership here with the Boys and Girls Club, but do it together and we'll give you this amount, and challenge us, and then that will help us or help them. I think we're probably, under my leadership, more apt to say yes. I'm more of a yes person because I want to just try to serve more. That's our mission. Our target in this new strategic plan by 2025 is to double our impact. We currently serve about 420,000 individuals each year in San Diego, so we're going to double that to 800,000 in just 7 more years. So to get there, we got to have some of these collaborations. We got to have some of these partnerships.
Let me ask you just on that as a follow-up. I understand the sort of math of doubling that impact. Do you have benchmarks that measure the depth of the impact on any family or individual?
Yeah. The impact is really how we measure it. It's not just bodies. It's what kind of programs, nutrition, living well, being a part of Live Well San Diego. That's one of the measurements, having partnerships with the city. It's not just building YMCA buildings and having people come. That'll help us grow, but it's got to happen through these partnerships. How can a non-member of the YMCA receive YMCA benefits? So let's say we had a program in the park, an exercise or a nutritional opportunity where people could just show up, and then we got to get them there. We got to mentor them and coach them into living healthier, and it's that repetition. We have a lot of YMCA's that have teaching kitchens, but if we can't get them to come to the Y to take the teaching, the class to teach them how to, cook better or to eat better, then it doesn't really matter.
So Nancy, we were talking in advance of this about your career that has included places like Texas and Hawaii, which doesn't get too much more different, though Alabama, where you gentlemen hail from,
I lived in Texas.
No,
or
no.
excuse me, Alabama.
He's from Alabama.
Louisiana, pardon me.
It's the same thing.
Good Lord.
It's the same thing.
Sorry to have blurred that line. But Nancy, how would you characterize sort of the unique culture here in San Diego when it comes to healthcare, human services, wellness? What is it, maybe more specifically, about the opportunities and the culture here in San Diego that allow for different things to happen in a different way that maybe San Diegans take for granted? Is there a community or cultural asset that's really special in your experience and perspective that maybe San Diegans take for granted?
That's a really interesting question. I'm not exactly sure how to answer it. I think that in comparing all of the different communities in which I have worked, I think that having leadership that has a vision that people can really get behind. I think Live Well is one of those opportunities that when Nick came on board, at first it was Nick's Live Well, right? But he was very adamant that it wasn't Nick's Live Well. And it wasn't the county's Live Well either. And just the continual persistence in making sure that it was the communities, that more community partners came on board to be where he's at. I think the last number I heard was 350, but that was a couple of months ago, so I'm sure it's over 400 by now. But just having that persistent leadership with a vision. And one of the notes that I had taken that I really wanted to make sure was a part of that was that a part of that is also listening to the community. And they have their resident leadership programs and they have the regional leadership programs that are really getting into the community and making sure that that's incorporated. They're talking to the organizations to understand what their needs are and having them be a part of that as well. So having leadership, and not just Nick, but also people that are in the hospitals, people that are in the nonprofits, that will say yes, that will be open to new things and new approaches and say, well, let's try it. It sounds interesting. Sounds like it could go. I think that's really important. I think very few, I can't say that. Some people, I think, in other communities kind of have their own perspective, say this is the way, this is the right way, this is the only way, I'm only going to do this, and I'm only going to put funds or make policies that make it happen this way. Not listening to the community, not listening to their nonprofit providers or other healthcare providers. And that slows everything down, it really bogs it down. Mm-hmm. So I think that's something that's really unique here. And I want to say everything's all peaches and cream and everything's really going great. And there's a lot of good stuff that's happening in our community, but we have our challenges as well. And trying to get everybody on the same page, to have a bigger vision about what is this culture of wellness or this culture of health that we want to have in our community. I'm sure if we were to talk to the panelists, we have a maybe different view of what that is, but how do we bring all of that together to have that be the overarching strategy about creating this culture of wellness for San Diego County?
Yeah. Donald, I'm going to ask you first, but each of you to sort of answer this question, which is to our audience members here, to the folks who will watch this online and through some of our public television partners. What counsel, advice, recommendation would you give to senior leaders trying to guide their organizations during this transitional time in healthcare and human services and wellness? What counsel do you give them as they look forward to what's coming in 2018?
Buckle up. It's going to be a wild ride. I wish I could predict what's going to happen, but probably the thing I remember as I go to work every day is I have this wonderful partner at the hospital who's been there for about 20 years. She's the chief administrative officer. She started her career as a psychiatric nurse, so that's very helpful for me because she does a little head shrinking every morning. But she reminds me we need to keep our eye on the ball. And I love the idea of innovation. I love the idea of collaboration. I love all of the things that we're moving. Precision medicine is unbelievable, but we got to keep our eye on the ball. We need to make sure that we're delivering high quality health care to take care of kids and families. That's the most important thing we can do for our community. That's getting harder and harder to do. And I think that the idea, we have a very robust home health care program, one of the only pediatric home health care programs in the nation, pushing professionals out into patients' homes, especially with chronic illness. Trying to get control of costs is really, really, really important. But I am going to predict we're going to be sitting here a year from now having the same conversation, because there's going to be a lot of left turns and right turns, and it's going to be a roller coaster for the next year or so.
Yeah, good. Baron, same question. What counsel or advice would you offer our audience?
Think of your local providers, if it's San Diego or wherever you're from, nonprofit, for-profit. How can together we can do more, I believe. I think we live that example. How can you engage them to help resolve or solve any problems? Not only will funders, I think, embrace that, but you will engage and serve more. So I think that it's really difficult. It doesn't always work because, you know, the YMCA is not in the business of serving people through medicine. We don't do that. But how can we help? Maybe it's something very, very small. Maybe it's something big, or maybe it's not the YMCA, maybe it's someone else. You know, we're for the Y here in San Diego or across this country, but we're also for people's health. So if we can't do it, or we're not the one chosen, we're not against anyone. You know, we're not against 24-hour fitness or LA Fitness or whatever. We want people to be well and to exercise and to enjoy life because we have great weather here. So let's go live it. But to get there, you've got to do the fundamentals with your health, and some of that is exercise regimen that makes you live longer and feel better about living. So we want to be a part of that, and I challenge you to challenge them.
Good.
I would like to add to that, because I think that I would really encourage people to, from your perch, from wherever you're at, it's a real interesting balancing act in keeping true to who you are and what your organization is doing and who you're trying to serve, along with don't isolate yourself or cut yourself off from the community, and be open to looking out there and finding out what else people are doing. One of the things is interesting, you said you have kitchens. One of the things that Michelle and I have been talking about is the fact that as people are trying to find both job training as well as ability to provide food for the people that they're serving, they're building kitchens. We're going to do a mapping of all the kitchens that we have in San Diego County, because there are many that are already coming to us and saying, we've got this open time. Nobody, you know, what can we use that for? And so just being aware of what's happening in your community, that it may not be in your field. Even if you're serving the homeless, that kitchen may be at the hospital. It may be at the Y, but it may be right down the street from you, and you don't have to build your own. So that's one of the other things that I think philanthropy is looking at, is how are we really being efficient in the things that we're recognizing we need in our community.
Wonderful. Let's give them a round of applause.
Thank you.
Dr. Donald Kearns, CEO of Rady Children's Hospital, Nancy Sasaki, the Executive Director of the Alliance Healthcare Foundation, and Baron Herdelin-Doherty from the, I want to not screw this up again, the Greater YMCA of San Diego County. Thank you all.